Good morning, ladies and gentlemen, to everyone under the sound of my voice. Welcome to this program today. I want to remind you, as always, Black life does matter. I will not stop saying this until when they stop murdering us. They cannot kill all of us. One day it will stop. And in the immortal words of my mentor, if you will, Malcolm, by any means necessary, we'll put a stop to it. So, after we got that out of our system, here we go. The title of today's program presentation is Oral Hygiene, Periodontal Disease, and its link to heart disease, ladies and gentlemen. This is the third installment of that three installment that we had. The first one was physical examination by Bertha Tott, who did a fantastic job. The second one was our eyes by Dr. Jason Pennycook, MD ophthalmologist. And today we have the great Dr. Woodson in the house, dental. In a moment, we'll bring him on and he will do his things. I need to remind you, Dr. Wes Youngberg wrote on page 9 in his book, Hello Health. You and I must be the one in charge of our personal health. Your personal physician cannot do it for you. Your mom cannot do it for you. No one can do it for you except you and I. Pray with me as we go down this road. Our Father and our God, we come to you today thanking you for this life that you have blessed us with. And what a life it has been, Lord. We could not write the scripts any better than you have played it out in our lives. So today, we want everything that is said and done here bring glory to your holy name, and that men and women may turn their eyes towards heaven. Bless Dr. Woodson as you have done in the past. Bless him today. In Jesus' name we pray. Amen. And here we go. This program is sponsored by the Kansas Seventh-day Adventist Church in Riverside, California, under the excellent leadership of Dr. Ainsworth Keith Morris, senior pastor. Let me pause here and put a parenthesis in here. Yesterday or Friday, he completed 5 glorious years here at this church. And I am talking 5 glorious years. He is a master of what he does. The Lord have called him, educated him. He's preaching all the continents in this world, I believe. And here is at Kansas. The church is in the black, has been in the black. Well structured, well run, well managed. And he's assisted by 2 amazing pastors, Dr. Michael Samuel Jenkins Jr., administrative pastor, Pastor Edwin Martin McBride Jr., associate pastor. And if you want energy, just look to Pastor McBride, full of energy for all of us. Tremendous work ethics, love for family, always willing to help. Has a wife, Sandra, 3 children, Sydney, EJ, and Savannah. Keep these men in your thoughts and prayer. All right. And this program is produced by Nirma Usher, tremendous, and her team. So today, Dr. Wilson will present. And after he done, we will come on and answer questions. But I need to tell you a little bit about him. And I am proud to read this bio. I'm going to point out something in this bio that I will always remember. Here we go, Dr. Alan B. Woodson. I'm going to ask him what that B stands for. Born and raised in Southern California, Dr. Woodson is a product of Christian education, attended Los Angeles Union from 1968 to 76, Linwood Academy from 76 to 80, graduated as valedictorian in both elementary and high school graduating class. He attended La Sierra University, my alma mater, from 1980 to 1983. And in 1986, Dr. Woodson graduated from Loma Linda University School of Dentistry, earning his doctorate, a black man, in dental science degree. He is presently listen to this, he's presently the owner and sole proprietor of a successful private dental practice in Upland, California, and serve as a part-time faculty and assistant professor in the restorative department at Loma Linda School of Dentistry. Awesome. Sole proprietor. Dr. Wilson is very passionate dentistry. He loves his career, loves sharing it with anyone who is interested, Dr. Woodson has been recruiting minority dental students from Oakwood University for Loma Linda School of Dentistry over the past 20 years. Dr. Woodson's office is always open for students and anyone interested in dentistry to shadow him. He spent a great deal of time training and mentoring future dental students and future dentists right in his office. Dr. Woodson also trains students in oral surgery and restorative dentistry in the mission field. He has been all over the world serving others while serving his student as well. Dr. Woodson has many passions as well. He loves music. He's a singer, worship leader, an award-winning choir director, has been the minister of music and choir director for the Mount Rubidoux Seventh-day Adventist Church for over 15 glorious years. Dr. Woodson also enjoys traveling, scuba diving. Dr. Woodson resides in Rancho Cucamonga, California. He's married to his high school sweetheart, Sylvia, for 35 years. And they have 3 children, Stephanie, Alan Jr., and Jocelyn. Dr. Woodson, if you would come on and join me. Where are you? Here you are. Take it away, sir. Welcome to the Kansas Seventh-day Adventist Church Health Ministry Program.
Hello, everyone. I'm so glad to be here. Usually when I'm in the Kansas company, I'm directing the choir over there or singing or getting you guys to open your mouth in some way or another. But during the week, I get people to open their mouths so that I can fix things. I hear them sing. So I'm glad to be in this position for you, and I'm happy to share some information on oral health. Anything that has anything to do with dentistry, I'm very passionate about. So I'm just glad to be here and glad that you would have me. And so today we are going to talk about oral health and how it affects your heart, how it affects your lifestyle, and some brushing techniques and flossing techniques and all of that good stuff. So if you're ready, I'm going to present that. Oral hygiene. Here we go. And if you notice those wonderful smiles there, that I'm in the business to make people smile. And if you can smile, I've done my job. And so I want to talk about oral hygiene. And before I do that, just to talk about my job, what I love about it, I not only take care of caries and periodontal disease, but I also do a lot of cosmetic dentistry as well. And just recently, I just had to share the story. Just last week, I did a cosmetic case and totally restored the patient's mouth. And when I gave her the mirror, she put the mirror up and pulled it down so fast and just started weeping and crying. She was so happy with her smile. And then I started crying because I was so happy for her. And so we hugged and we just shared some time together. And I said, these are the moments that I live for, when I can completely change someone's self-confidence, completely change their life. She was so grateful, and so was I. So it just reminded me, this is what I do. And these are the moments like that I live for. So anyway, let's go on with oral hygiene. Okay, before we talk about that, let's talk about the culprit, tooth decay. I want to describe what tooth decay is and how detrimental tooth decay can be, because these are the things we want to avoid with our oral hygiene. So I just want to give you an anatomy of the tooth and give you a little insight of the mechanisms of that. So there are the external structures of the tooth. The tooth we can divide up into 2 parts. The crown, that's the part you see above the gum line. That's the white part that you see above the gum line. But the tooth is actually larger than that. There are the roots of the teeth below the crown, and that is below the gum line. and into the bone. That is the root. So you got the crown that you see and the root below. The root's kind of like the roots of the tree. That holds the teeth in the mouth. That holds the teeth in the skull. Okay, that's below the gum line. All right. Now, the internal structures of the tooth, we have the pulp. That is the innermost part. That's where the nerves reside. If you have a toothache, that nerve is telling you that there's something wrong. The nerves are indicators that something's wrong. So the pulp is the innermost part of the tooth. It has all the nerves and the blood vessels. Just outside of that is the dentin. That's like a yellowish color layer that surrounds the pulp. It protects the nerve, okay? Protects the tooth, as it were. And then there's the enamel. The enamel is the white material that you see. And enamel is somewhat translucent. So the dentin is a yellow color. So the enamel is white, but it's a little translucent. So your teeth aren't white, white, white. There's a little bit of natural yellow color to the teeth, as people may not realize. Okay, so the enamel is a hard layer that surrounds the tooth. And then the cementum is a small layer. It's kind of indicated by the green, by the little gray area. It's a little layer that surrounds the root. Okay, so that protects the root, and it acts like a shock absorber. The teeth are not completely embedded in the bone. There's a little cushion around the tooth that help the teeth. The teeth actually move slightly. So they're kind of like shock absorbers as you chew. So the cementum and the periodontal ligament acts as a shock absorber for your teeth. So they're not just grinding directly on your jawbone as you eat. So what is tooth decay? All right, tooth decay is a degradation process that results in permanent structure damage to the infected tooth. A common name is a cavity, or we call it caries. And the main cause for tooth decay would be a diet that has lots of sugar in it. The sugars, now we have a natural bacterial flora in our mouth all the time. Our saliva has bacteria, natural bacteria that help against infections and so on. But when you eat sugars, the sugar combines with the bacteria in your mouth plus the acid, and that combines together against the tooth and can cause decay. That bacteria forms plaque. The bacteria from your mouth and the waste products from the things you eat. It could even be, it doesn't even have to be sugars. It could be green beans, leafy, it could be healthy foods. It's the byproduct, which is the byproduct from those foods, plus the bacteria in your mouth combine and form plaque. Plaque is the culprit. Plaque is the soft, sticky stuff that you find on your teeth that it appears 2 hours after you eat something. So plaque is the devil. You want to get rid of him. And unlike the devil, plaque is a lot easier to get rid of with flossing and brushing, and we'll talk about that. But that plaque is the culprit. It can cause decay. That plaque can also cause periodontal disease. Plaque is also the stuff that you find on your teeth when you wake up in the morning. That film that you feel on your teeth when you wake up in the morning, that is plaque. It can be removed very easily with brushing and flossing. It's very soft. But I will talk more of how plaque can be hard and cause more damage. But before we do that, we're talking about decay right now. So stage one, decay occurs in stages. Stage one, you might see little white spots on your teeth, or we can tell in the office when we do our exam. There's a yellowish spot or a chalky white area on your teeth. And that is usually indicating the start of decay. And that is because that bacteria, that plaque, is eating away at the calcium on your teeth. Now, when we're in stage one, it is most of the time reversible. We have special toothpaste that you can use called MIP paste. It has a calcium hydroxide and it has calcium in it. It has fluoride in it. It has a calcium hydroxide in it and fluoride. It can actually reverse the stage one of decay. That's the very early stages. But beyond stage one, it is not reversible. Stage two, that enamel is starting to break down. Remember when I talked about the white area covering the nerves or whatnot? That's the enamel. That starts to break down, and that is what we call stage 2. Once we get into stage 2, once it's no longer a little white spot, we have got to remove that decay, i.e. a filling. And we do fillings in our office. We do the white fillings. We don't do any of the silver fillings. And we'll talk about that in a minute. But the treatment for that would be a filling. Now, stage 3. Remember that second layer I talked about, that dentin, that yellow layer? Well, the decay goes into the dentin. Once the decay reaches the dentin, now you might start feeling a little pain at this point. If it's in the enamel, you may not feel anything. Most of the time, you don't feel anything. And that's why we want you to come to the office for a checkup. Because if you go by just pain, a lot can happen before you feel anything. So you want to come every 6 months so that we can take x-rays. We take x-rays once a year. We examine the mouth to make sure there's no decay, because you won't feel decay necessarily. When it gets to the dentin, sometimes you might not even feel that either. So the dentin, when the decay goes into the dentin, you might feel some pain at that point, or some sensitivity to cold or hot. It could be increasing or may not even be present. Okay, so that's kind of what it looks like. It's going into that second layer, and in the mouth, you'll see the picture there. It's the dark holes. Okay, now stage 4. When we get to the pulp, you most likely will be in pain. And so, excuse me. All right, you most likely will be in pain when it reaches the pulp. And when it reaches the pulp, it causes a lot of pain. There's infection that starts to set in, and then the infection fills up where that nerve was, and then it has nowhere to go but out. So then it starts to push its way out through the bottom of the tooth. You see that little red bulb below the tooth there? That infection is pushing its way out, and then we get pus formation. It's like a huge pimple. You have pus, and oftentimes it drains, it smells, it's painful, and you do not want to get to that level. Now, the way we treat that is a root canal, okay? So once we can either treat it with a root canal or we pull the tooth. Now, I'm in the business of saving teeth. The last thing I want to do is pull the tooth. So what a root canal is simply removing that nerve tissue out of the tooth and filling it up with a special material. This way we can save the tooth rather than pull the tooth. But that tooth's going to hurt and cause infection if we don't do something. And that is the best way to treat a tooth that has reached stage 4. Now, sometimes, believe we have a stage 5. Okay, that stage 5 is that abscess that forms where the bone is destroyed around the tooth and you get the swelling, and we'll give you antibiotics to take care of it, and we'll treat it with the root canal or extraction. Sometimes the decay is so large that it has destroyed the majority of the tooth, and unfortunately, we have to extract the tooth because there's no tooth structure to save. Well, we hate to do that, but that's what we would have to do if we reach beyond stage 5, if the tooth is just destroyed beyond. So how do we prevent tooth decay? We want to limit our eating and drinking between meals. Why? Because most of the time, you're not going to have time to brush your teeth in between meals. You want to limit that. You want to limit your sugar consumption. The plaque loves sugar. The bacteria in the mouth loves sugar. Sugar causes a very sticky substance on our teeth. So it's hard to remove. It's not removed as easily as other foods. So if you do decide to snack, so if you brush in between meals 3 times a day will be great. 2 times a day is sufficient. By the way, you want to brush twice a day, the morning and the evening, and you want to floss at least once a day. So if you brush twice a day after breakfast and after dinner, and then floss after that before you go to bed, that would be great. So brushing twice a day and flossing. You want to have your regular checkups. You want to go to the dentist every 6 months. A lot can happen in 6 months. When snacking, if you are going to snack, like I was saying, you might want to take some foods that are like fruits or nuts that can help actually remove some of the plaque. Like an apple is great. If you just must snack, apple would be great. That helps remove some of the plaque off of your teeth if you have to snack. It's better if you don't have to snack. Drink water. That's the best thing to do. If you get that urge to snack in between, drink water. That would be the best thing you could do. Okay. Let's talk about periodontal disease. Now, we talked about decay. Now, you've heard about periodontal disease. What is that? What does that mean? Well, let's break that word down. Perio means around. Dontal means teeth. Dontal means teeth. Disease is disease. There's a problem there. So there's a disease around the teeth. Okay? What in the mouth is around the teeth is the bone that we talked about. Okay. So here's the anatomy of the tooth. You've got the white part that you see. Then you have the gums. All right. If we did a cross section, you can see how the bone is just below that. So the bone holds the tooth in place, the bone in your jaw, and then there's a coating of the tissues around that. Okay. Now, the picture doesn't show it too well, but if you can imagine a turtleneck around the tooth, and the turtleneck is the gums, okay? Now, around the turtleneck, if I were to use my shirt collar as an example, I can stick my finger down that turtleneck. There is a little space called the sulcus between the tooth and the gums, and we have a special instrument called a periodontal probe that we probe down into the tooth and the gums, and we want that number to be 2 to 3 millimeters. That indicates healthy bone support around the tooth, 2 to 3 millimeters. Now, as the plaque that we talked about earlier, not only does plaque affect the enamel on the teeth and cause decay, like I told you, plaque is the devil. Plaque, you want to remove that as soon as you can. Plaque will destroy, first of all, it makes the gums irritated. And if you brush and floss and you're bleeding, that's called gingivitis. That's the first stage of periodontal disease. That means your gums are irritated because of the plaque. Now, if that is not removed, that plaque becomes hard. If it's not removed soon, over time, the plaque from your saliva, the plaque in your mouth that forms, in addition to the saliva that you have, the saliva has calcium, and the saliva has magnesium salts in it. Those salts combine with the plaque and form tartar. Now, tartar is the hardened form of plaque. There's a big difference between tartar and plaque. Plaque can be removed with brushing and flossing very easily. Tartar cannot be removed unless you go to the hygienist or the dentist to remove it. You cannot remove it yourself. That keeps us in business, by the way. So the tartar is kind of like the scum of a bathtub ring. It's like a bathtub ring. You got to scrub it off. The bathtub ring, you got to scrub it off with Comet or detergent. So with tartar in the mouth, we scrape it off. We have different tools that remove tartar by scraping, or we have electronic tools that buzz it off. So that tartar starts to eat away, not only at the gums to make them bleed, but it eats away at the bone. So that bone level that's holding that tooth in, that tartar eats away at the bone. And guess what happens if we lose so much bone? We remove bone, tartar is horrible on the bone. After a while, we have so much bone loss, guess what? We end up losing the tooth. And I've got to pull the tooth out because there is no bone support. So let me show you some. So we talked about gingivitis. What is gingivitis? It's the red swollen gums. It bleeds when it's irritated. Gingivitis, as I said, is the beginning of periodontal disease. Gingivitis is reversible. That's a good thing. We can reverse the gingivitis. We can remove the plaque with brushing and flossing techniques, which I'll show you. When we do that, the gums become healthy. They don't bleed anymore. They tighten up around the tooth, and we have reversed gingivitis. When the bleeding stops, we have reversed it. Periodontal disease, on the other hand. Now look at this gross picture. Look at all of that. You see the tooth? You see that buildup? Look at that yellow buildup. That is tartar. Look at that brown staining. That is the beginning of tartar. Look at those gums. They are unhealthy. They're bleeding. They're red. They're not pink. They're not sharp. In between the teeth, you should have sharp gums. The gums should be sharp, like a scalloped edge. But if you notice, the gums here are sloughed off, red and bleeding. The tartar is destroying the bone around the teeth. Those teeth are loose now. So bacteria, there's a bacterial infection of the tissues. The gums, that's the gingiva. The periodontal ligament, that's that shock absorber that I was telling you about that helps the teeth move as you chew. Then there's the bone, remember that, and then the cementum is around the bone. So the causes of that is that plaque biofilm that I was talking about. The plaque, the plaque stays on the teeth, and periodontal disease, once we lose bone, we cannot get it back. It's irreversible. What we try to do, myself and the periodontist, the specialist, we try to maintain the bone by doing bone. We try to add bone by giving bone grafts, by causing my hygienist, myself, or the periodontist. We will treat you periodontally so that you don't lose any more bone. We want to minimize the bone loss, okay? But we can't get it back. And that's what I mean by irreversible. We cannot get the periodontal disease. We cannot get the bone back. There are limited procedures that allow us to add bone, but very, very, very limited. So the key is, let's not get there, folks. Let's prevent. Let us not get to the stage where we're losing bone, okay? Gingivitis is the first indicator, the bleeding gums. See your dentist regularly. He can tell you, he or she can tell you the stages of periodontal disease by our x-ray. So let's look at that. So in stage 1, see that little probe? If you could look at that diagram, that little probe is going down the turtleneck of the tooth, and 1 to 2 millimeters, 2 to 3 millimeters is healthy. And if you look at the gums in that picture, the gums are pink and they are scalloped. You see how they're scalloped around the teeth? And on x-ray, there's a bone level. The bone level, you see the bone level is just below the crown. Remember that, the top of the tooth that I showed you, that divides the bone divides the crown and the roots. The bone level is right in between the crown and the roots. Very healthy. That is the healthy spot. That is stage 1, healthy teeth. That's the first picture, healthy teeth and gums. Now, 2, you look at that probe. The probe is still about 2 to 3 millimeters, but the gums are irritated. They're bleeding. We don't have bone loss yet, but they're bleeding. That's gingivitis. Now, if you look at the diagram number 3, notice we're starting to lose a little bone. Look at that cross section. Look at the bone starting to deteriorate. Look at that probe. That probe is now 4 to 5 millimeters down the tooth. Okay, so I'm down the tooth, down my turtleneck. I'm going down about 4 or 5 millimeters now. That's how the gums are bleeding, and the bone loss we can't see with the naked eye. We have to see that on the x-rays. But if you look at that x-ray down there, that line going across those teeth is lower. Now look at 4. Look at stage 4. Oh my goodness, this is moderate periodontitis. Okay, so itis means inflammation. Perio means around the tooth. Dental means tooth. So inflammation, periodontitis, if we break that word down, is inflammation, itis, around perio, the tooth, dental. So moderate periodontitis. So you see that probe is now a 6 or a 7. Look at that bone loss. There's no bone holding the teeth in. There's no bone. Now look at 5. We've got so much bone. There's no bone left. Look at the teeth are loose. They're falling out of their head. We've got to take those teeth out now. We've got to extract. And this, let me tell you something. More people, I could pose the question, do you think more people lose their teeth because of periodontal disease or because of cavities? Most people think they lose all their teeth because of the cavities. But let me tell you, Most people lose their teeth because of periodontal disease. It is possible. This is so important right here. It is possible to never, ever have a single cavity in your life, but yet you can lose all your teeth simply because you have no foundation to hold them in. So if you look at this picture here, some of these teeth don't have a single cavity on them, not a crown, nothing. They're virgin, what we call virgin teeth. But yet I've got to pull them out because there's no bone support, because plaque turned into tartar, destroyed the bone. So we've got to get rid of that plaque. We got to get rid of that tartar. Now, let me tell you, here's the key. Now, that periodontal disease, can you imagine the bacteria in the blood when this is going on? There's a lot of bacteria in the blood because of the tartar and the bone loss. That bacteria travels to the heart, which can cause heart disease. Believe it or not flossing can cause heart disease because floss removes the plaque. Plaque turns into tartar. Tartar removes the bone. The bone destruction and the inflammation caused by it causes high concentrations of bacteria in the blood. Where does the blood go to? The heart. That bacteria is pumping through the heart, in and out of the heart. Therefore, it can cause heart disease. This is, if you don't remember anything else today, remember that the bacteria in the blood caused by the bone loss, caused by the tartar, caused by the plaque, which the plaque is only there because we didn't remove it. The tartar is only there because you didn't go to the dentist or hygienist to remove it. So you can easily prevent heart disease by proper oral hygiene, proper care to the dentist or hygienist. Periodontal disease, and we'll go into more detail of flossing and brushing techniques. Periodontal disease causes other things. If the mother has periodontal disease while she's pregnant, chances are her baby is going to have low birth weight. The incidences of stroke are much higher with people who have periodontal disease. Why? Because it's putting a load on the heart. It's decreasing the oxygen in the blood. That bacteria is no good. And we talked about heart disease. Periodontal disease can lead directly to heart disease. It's because of the bacteria in the blood. So, prevention. There's good news. There's something we can do. As long as we catch it in time. Otherwise, we got to take the teeth out. We don't want to do that. Flossing once a day. I recommend flossing once a day and brushing twice a day. I recommend brushing after breakfast because, there's plaque-causing foods. Also, all night, that plaque has been building up. So brush after breakfast. And then go about your day. If you after lunch, it'd be great to brush after lunch. But most people don't have time to do that, or they don't carry the toothbrush with them. If you're going to, at the end of your lunch, an apple would be great. If you can brush, then that will be awesome. And then you want to brush right before you go to bed. Those of you who are married, your spouse will be happy with that. Brush. Now, most people say they don't have time to floss or whatnot. Flossing is an investment like anything else. But I just recommend floss at night, after dinner, right before you go to bed. Brush, you have time. Brush and then floss right before you go to bed. That's going to minimize that plaque overnight while you're sleeping, because that's where most of that plaque's going to form. So it does two things. Your spouse will be happy. You'll be happy if you remove the plaque at night before you go to bed. So brush twice a day, floss once a day. Brush in the morning and the evening. Floss in the evening is my recommendation. You can floss in the morning too if you'd like, but at least once a day. Regular dental checkups and cleanings. Now, no matter how well you floss, tartar still has a way of forming, not much. And the more you minimize the plaque, the better. So you're still going to come for your regular checkups. Why? When you come to a dental checkup, we're going to see so many things you can't see. We're going to take x-rays. We're going to see the bone support around those teeth. We're going to detect periodontal disease if it's occurring a lot sooner than you can. We're going to detect decay. A lot of times you're not going to feel pain if you have a cavity. We're going to see that on the x-ray. Some cavities only show up on x-rays and you would never know it. So that's why dental checkups are important, regular checkups. So much can happen before you even feel it. So we want to be there to detect it. Prevention is the name of the game. If we can catch, if you've got a small cavity in that enamel area and we can catch it with just a filling before it goes to a root canal, that's what we want to do. So you don't want to wait till it hurts. People get it wrong. They say, oh, the dentist, oh, I don't like going to the dentist. The dentist causes pain. No, the patients cause pain because they don't take care of their teeth. We're getting you out of pain. So we get the bum rap with associated that we cause pain, but you know what? We get you out of pain. You cause the pain by not coming in. You cause the pain by not flossing and brushing properly. You cause the pain by letting things go until they hurt. So I just want to give a shout out to the dentist that's and give ourselves props that we don't cause the pain. We put you out of pain. We do our best to get you out of pain. We try to undo what you did. Anyway, nutrition is very important. And I'll talk a little bit more specific about nutrition there. Yes, here we go. So these are the things that are going to help you in your oral hygiene. And these are healthy foods. You want to have a diet rich in calcium. Dairy products are, or if you're vegan, you have other sources, green leafy vegetables and the fortified foods. If you do dairy, the lactic acid benefits against periodontal bacteria. So the lactic acid in dairy products help against the bacteria that we find in periodontal disease. Now, some people don't do dairy. You can still do the whole grains. That reduces inflammation, like the oatmeal, the dark breads, the brown rice. Vitamin C is very good. It reduces inflammation and repairs the connective tissues. Good sources of vitamin C would be like strawberries. I love strawberries. Broccoli. I love broccoli. Papaya, bell peppers, things like that. Diets rich in vitamin C will be great as an attacker against periodontal disease. Okay? Now, oral hygiene. Let's talk about how we prevent periodontal disease and how we prevent decay. Therefore, how we can improve our oral health or maintain our oral health. So there are techniques. Why do we brush? We brush because we remove that daily buildup of plaque that I talked about. You remember, plaque forms 2 hours after you eat anything. It doesn't even have to be sweets. Plaque can be removed by brushing and flossing. Calculus or tartar, you cannot brush or floss. I want you to get the difference. There is a big difference between tartar and plaque. Plaque is soft, removable. Tartar is hard, not removable, except by the dentist or hygienist. So tartar, calculus, another name for tartar, cannot be removed. Plaque forms 2 hours after eating anything. Tartar forms from unremoved plaque. So you can't get tartar without the plaque. So the key is remove the plaque. So tartar forms under the unremoved plaque and must be removed by the dentist or hygienist. So make sure you understand that. Okay? And that tartar is just as bad as the devil. It destroys. It does worse than plaque. It destroys bone and destroys your oral health. Okay, proper brushing. The proper way to brush. One of the best way is there's different methods. I recommend the sulcular method. Now, sulcular is that little area, the sulcus. Remember I talked about the sulcus going down the turtleneck in between the teeth and the gums? That's called the sulcus. So the sulcular method is a method that aims toward the sulcus. You're going to aim your brush 45 degrees. So the indication for that is to remove the biofilm directly beneath the gingival margin. The margin is the top of the turtleneck. So plaque gets down in there, and not only are we going to remove it on the tooth, my head would be the tooth, my turtleneck would be the area below. So that's the gingival margin, the top of my turtleneck. Open embrasures, that's the areas between the teeth and the contact areas where your teeth touch in between there. And it's great for periodontal patients, and it removes the biofilm surrounding partials and braces if you have braces. So this method is great for periodontal patients. It's great if you have braces. It's great if you have partials. You want to take your partials out and brush them and brush your teeth in the sulcular method. Now, see how that toothbrush is angled 45 degrees into that gum line? That is the proper way to brush. And you're going to use small circles. So you place the tooth surfaces on the gum line there, 45 degrees, and the handle is parallel to your biting surface. Do you see that? The handle is going to be parallel to your biting surface, and you're going to brush in small circles, okay, along the gum line, that's called the sulcular method. You're brushing along the sulcus. Now, you want to aim 45 degrees, complete circular strokes on the side, and then, so think of the teeth as having 3 sides. You want to start with the cheek side, brushing along 45 degrees, going all the way around cheeks and lips. Then you're going to do the tongue side. You're going to go inside. And if you notice that on number 3 right there, you see how the person's brushing on the inside now, on the tongue side. So you got the cheek side all the way around, top and bottom, then the tongue side all the way around. Now, as you get to the front on diagram 4, you angle that brush long way so you can get those small teeth, and then continue, as we see in diagram 5, back to on the inside. Then the last, and this is in diagram 5 as well, the last area that I want you to brush is the first area that everybody brushes. I don't want you to forget these other areas. So I recommend brushing that part that you bite on. We call that the occlusal surface. Brush that last. That's the part where you can brush back and forth, okay, on the parts that you bite with. But everything else, you got to use that circular motion. You're going to brush back and forth only on the biting surfaces because you want to get that food and particles out of those grooves in your teeth. Brushing should take you 2 minutes. It should take you approximately 2 minutes, no less. So you want to brush the top for a minute. So you can divide the mouth up into 4 quadrants. The upper right side, the upper left side. So that's 15 seconds there, and then 30, and then you'll get a minute. If you divide that up into 15-second intervals, you'll get a full minute for the top and a full minute for the bottom. So divide each quadrant into 15 seconds. Top and bottom, left and right, tongue and cheek. Or yes, cheek side, tongue side. Now, if you're going to have an electric toothbrush, I recommend highly, if you do get one, make sure it has a small round head. Now, I'm not a believer in Sonicare. I'm sorry to shout out a product, but Sonicare doesn't do any different than your regular toothbrush. It's got a long head. But the electric toothbrush that I recommend is like the Oral-B because it has a round head. If you see this picture here, that looks just like the polishing cup that we use to clean your teeth in the dental office. If you've been to the dental office, the polishing cup that we use to clean your teeth is a small circular head. It looks almost exactly like that toothbrush. The best way to brush your teeth is 1 tooth at a time. That's the best way. So she's using the sulcular method, but she's also brushing 1 tooth at a time. That head is only big enough for 1 tooth. Okay, so as we go around, you're going to brush 1 tooth at a time. That is the best. That's the way we clean teeth. So the way we clean teeth is the way I want you to brush your teeth. So if you're going to invest in an electric toothbrush, get one that has a small circular head. Oral-B is the one I recommend, and it looks just like the picture she has right here. Why do we floss? Toothbrushing alone cannot accomplish that biofilm or that plaque removal. So the interproximal, that's the part between the teeth and the adjacent, the floss goes in between the tooth, remember that turtleneck, and the gums. Now look at that floss. The proper way to floss, do you see how that floss, it doesn't just go in between the teeth, it goes in between the gums. We want to make a C shape around the tooth. We want to take our fingers. We want to take our third finger, wrap it around our third finger, and use our second finger to make a C shape around the tooth. You see how that floss is making a C shape? By that, we can go under the gums. We can go inside of that turtleneck. If we don't make a C shape, we're not going to be able to get on the turtle. We'll actually do damage. We'll be cutting the gums if we just go straight. And that is the problem with these floss holders. Floss holders are better than not flossing at all. But if you have a little stick with a floss on it, that's fine to just get food out from your teeth if you want. But it's not going underneath the gums. If you do that, you got to pull tight so that you go under the gums. Most of the time that stick is too straight and you could end up damaging your gums because you're flossing on top of your gums instead of inside of your gums. The best way, if you don't floss at all, it's better than not flossing at all using those. And you can quickly do it in the car. But the proper way to floss is with your fingertips. And it's better if I can show you in person, but basically you want to use your third finger and you want to use your second finger, get them very close to your teeth and pull back on the tooth behind the floss to get underneath like this picture shows, and then come up over the gums and pull back to get the other side where that floss is, the other side of the tooth. Okay? So that is the proper way to floss. You got to get underneath the gums, and the only way to do that is to adapt that floss with your two fingers, your two pointer fingers, okay? Common mistakes in brushing. What is it? Abrasion. Look at that. That's horrible. You can brush your teeth too hard. If you're scrubbing your teeth back and forth along the gum lines rather than those circles, you can actually wear your teeth away. The only time I want you to scrub is on the biting surface. No more. Only use that sulcular motion, 0.45 degrees into the gum line. If you brush real hard back and forth on the side, you can cause damage. Okay? See that abrasion? Look at that wear. See the gum line there? How it's pulled away from the tooth? Mostly on our eye teeth, our canines. That's where we see it the most because that's a prominent area. The cervical area is the part near the gum line. Look at those notches in those teeth. That's from brushing too hard. So you want to use that sulcular. When you use the sulcular method, that will not happen. Now, we can fill those. Once that happens, we can fill those areas up if it's pretty severe. If it continues, you actually can get into the nerve, and then guess what happens? You need a root canal after that. So it's possible to brush your teeth so hard, you could cause a root canal, if we're to be honest, if we're to be extreme. Okay? So, see if is he brushing properly or improperly? The answer is you can't tell. His position is great. It looks like he's angling it into his gums. But if he's using circles, he's brushing properly. If he's brushing back and forth really hard against the gum line like that, he's brushing improperly. So the answer is you cannot tell. He has a proper position, but it all depends on his strokes. If he's brushing really hard back and forth, that means he's brushing improperly, and he can cause tooth damage or abrasion. Okay? By the way, I didn't mention this. You want to use a soft brush. A hard brush can do damage. The only reason why I don't know why they sell hard brushes, but hard brushes should be used to brush a denture, not your teeth. So use a soft brush, and that soft brush is going to adapt to the gum line much better and not cause damage or abrasion to your teeth. If you brush with very abrasive things, you can damage your teeth as well. All right. We are open for questions. I see lots of questions on the chat here. I'm going to have my friend filter them for me. We've got lots of questions here. So where do we start? What do we want to put first?
All right. Dr. Woodson, can you hear me? Here we go.
Yes.
So the first question I have that is not in the chat is, how long does a root canal last?
Oh, good. Root canals, we know what they are now. Remember, we're removing the nerve and we're filling the nerve. Now, after we do a root canal, I didn't mention this, but we need to do a crown on the tooth. Okay? A crown is a whole tooth that we put over. If you don't get a crown in heaven, you're going to get one today. But crowns go over the teeth. So if you want a starry crown, you can get one on this earth. If you have a root canal, the tooth is brittle and it can break. So you must put a crown over the tooth. A crown covers the whole tooth. It's like getting a whole new tooth. And it's a structural process that goes over the tooth that protects the tooth so that it doesn't break. And therefore, the tooth can last. Root canals on average last 10 to 12 years. I've got cases that have lasted 30 or more years. I've been doing dentistry 35 years. I have root canals that are still good. So root canals can last 30 years. The average, though, I will say, would be about, I would say 10 to 15. Sometimes they have to be retreated. Sometimes they have to be surgically treated. Sometimes the infection reoccurs, and then we've got to go in through the bottom of the tooth. The endodontist would do that. A specialist can do that, and they can remove so a root canal can still be retreated. So if a root canal goes bad, it still can be saved in most cases. Sometimes we can't. Sometimes the reinfection is too much, and we have to pull it. So like I said, the average is 10 to 15 years. They can last 30 years or more.
Thank you, sir. Yeah, we have another question regarding the maintenance of our mouth. Should we use this? This is a tongue scraper. Should we or should we not?
Yes. If you have a tongue scraper, by all means use it. Why? Because our tongue you can use a tongue scraper, and a toothbrush can do almost as good. A toothbrush can do the job as well. A tongue scraper, though, is great because if you microscopically look at our tongue, it's like shag carpeting. It's very deep air. It's like all these little fingers on your tongue. If you were to blow your tongue up, you see all. And so sometimes it's hard to get a toothbrush to get down in there. A tongue scraper gets down in there, and it feels great, and it removes the plaque. It removes the plaque on your tongue, therefore lowering the bacteria. So yes, right. A tongue scraper that don't cost much is a great investment.
And just to make sure, this is the floss you were talking about, the handle and the flask. You recommend the ones on the right. This one.
Absolutely. And do you understand why?
Yes.
Okay. You see that what you're holding, the green, see that short little piece of floss?
Yes.
That, if you want to get some food out from between your teeth, fine. You want to stick it in there. But that's not going to get into the turtleneck.
Okay.
Okay.
Gotcha.
Because it's not long enough. Now, if you do that, you got to push it really hard. It's not going to adapt to your tooth like the floss does. Yes. You want to take that third finger, put it on, put that floss, see, that's the hard way to floss. Put the floss on your third finger. We're going to show everybody right now. I'm going to have you do it.
All right. Third finger.
Put it on your third finger.
Right here. This one.
Third finger. Put the floss around your third finger. Most people don't realize. Put it on your third finger. Now, take it off your index finger over there. Put it on the third. Put that floss, wrap that floss on. Now use your index finger. Put them together. Put your index fingers closer together. That's how you floss. You put that in between.
Okay, I got you.
And that's how you adapt the floss around your tooth. Use the second finger. You did a great job.
Hey, Pastor, Doc, make sure you take me with you on your rest of your presentation for
what's that?
Take me with you as Vanna when you're doing your presentation, okay? So I can show the show and tell.
Oh, okay.
All right. Here we go, Doc. We have a lot of questions for you. Some of them you have responded to. Let's go right down and see. Let's see here. Watching you. A lot of kudos. It's really amazing. Proud of you, doctor. Wow, look at all of it. Can you see this, Doc?
The questions?
No, I mean, can you see on the right side?
Yes. I see
right.
A bunch. I see
a lot of them.
Yes.
Here is one that I don't know if you let's do this one, Doc.
I like that one. Okay. You should change your toothbrush once you see that the filaments are bending. That is usually 3 to 6 months. If you have a regular dentist, like in our office, we give you a toothbrush every 6 months. So you come in. So if you could, every 6 months would be ideal. If, though, for some reason, the toothbrush bristle starts bending sooner than that, change it. Okay. Some people don't last but 3 months, but every 6 months. And like I said, if you have a regular dental appointment, if you come to my office for your checkup, you're going to get a toothbrush. every 6 months, and toothpaste and floss.
Awesome.
So yes, every 6 months max.
Awesome. Here's another one, Doc.
Where and how do you schedule it? Where you should schedule it is Dr. Woodson's office. That's where you should schedule your appointment. No, of course, you want to find a dentist that you're happy with. There are dental offices everywhere, but obviously, we would love to see you in our office. Support African American business as my own business. But anyway, how do you schedule a dental appointment? Very, very simple. The telephone. You call the office, and if you call our office, my wonderful secretary and office manager, Kelly, will be happy to schedule an appointment for you. Very easy. We have a website as well. Most dental offices have websites. You can schedule on the website. We prefer the personal touch. So you can go on the website, our website, for instance, and say you would like an appointment, and then we would contact you and make that appointment. Some offices, you can schedule your appointment right on their website, but it's very simple. Once you find an office, you call the office up, and they'll be happy to schedule you.
Here we go.
Yeah.
I have another one for you, Doc.
Okay. There has been a lot of talk about mercury fillings. Okay. Now, just so you know, in our practice, we do not do silver fillings. We do white fillings, composite fillings. There have been studies, and they still have not proven that mercury poses a risk. There are some studies that have linked. They cannot prove it. They have not proved there is mercury, but the mercury in silver fillings is so small, it's pretty much non-detectable. Some people think there was Alzheimer's disease associated with mercury fillings, that they had pain, and when they removed their silver fillings, their pain was gone. It has not been proven that mercury causes a risk to our health. There are offices that still do mercury fillings. Now, I remove a lot of the mercury fillings, but the reason why I remove the fillings is not because they pose a risk to our health, only from the standpoint that there are some properties of white fillings that are better than silver fillings. For one, white fillings, they expand and contract at the same amount of time that your tooth does, whereas silver is called thermal coefficient of expansion. The degree from which a material expands or contracts as it is exposed to hot or cold liquids. When that happens with silver, it works against your tooth and can cause your teeth to fracture because it expands and contracts at a different rate than enamel. Therefore, it can cause fractures and therefore can cause you to need crowns. Whereas white expands and contracts with your tooth because it's the same thermal coefficient. So white fillings, you have a less chance of breaking the teeth. White fillings look nice too. I mean, that's an advantage. White fillings, you can detect if there's going to be decay underneath the filling. By the time it occurs under a silver filling, it's usually too late. It's usually root canal time because x-rays do not penetrate silver. You can't see the decay until it's too late. White fillings, if you start to get a cavity under a white filling, I can see it right away because the x-rays penetrate white. So notice I didn't say anything about health. All of these factors are beneficial, are benefits of white fillings. We have not proven that mercury causes a risk to our health, only from the standpoint that I can't see decay through silver fillings. But the mercury and silver fillings, they have not proven that. And so I don't remove fillings to make a health claim. I do them for other reasons. If a filling, just a good rule of thumb, if a silver filling is over 10 years old, you should change it. Usually there's decay underneath there.
So Doc, here's a yes or no question.
Of course. Yes. You want to brush? Yeah, I forgot to mention that in the regimen. Brush twice a day, floss once a day, and after you floss, you're going to want to rinse. So that's when you can use your mouthwash. You can use the mouthwash right after you brush as well. Mouthwash is going to be great. It's got fluoride in it. It's got antibacterial properties in it. It's going to help keep your gums fresh. So mouthwash is great. You want to try to get the one without alcohol base if you can. You're not consuming it when you rinse, but I like the ones without alcohol. Have you found vitamin D on dental? Yes. Vitamin D is good with calcium. It's going to be great for your bones, the bone around the teeth, right? It's going to help with periodontal disease. Your enamel is pretty much mature after a certain age. So the calcium is not going to necessarily improve the enamel. The fluoride will at that point. Fluoride in toothpaste will help remineralize enamel. The vitamin D, in the early years, like children, I saw another question up there. Will children with vitamin D be good for the children? Yes, as their teeth are forming, as their permanent teeth are forming within the bone, that's going to be great. The vitamin D is going to be great for your calcium uptake it's going to help with the bone around the teeth. Remember, that's going to help against periodontal disease because it's going to strengthen the bone around the teeth. Soy milk. How valuable is soy milk? Well, the great thing about soy milk, there's the unsweetened, and that's great because it's unsweetened. So there are definitely benefits. It's healthy. The almond milks, the unsweetened is preferred because that's going to be better than the sweetened. It's going to be less sugar. So if you can do unsweetened, that would be great. But the soy is still better than regular. How can we tell if we are offensive to others? Would that mean the breath?
I assume so, yes.
You're offensive if you get on my nerves. That's how you know. Oh, okay. Well, they'll tell you. You can ask, hey, how's my breath? Hey, you can ask. You can safeguard against that by brushing and flossing properly and using mouthwash. You can take a mint during the day, but you won't know. One way you can tell is you can smell your breath. Actually, you can put your mouth very close, and you could actually lick your hand if you feel like doing that, and then you can sniff really, really hard to see what that smells like. Make sure there's nothing on your hand because that's what it'd be smelling. But
here we go.
That's how you can. That's how you can tell if you're worried about the halitosis. And by the way, periodontal disease. If you have that tartar, remember that ugly picture I showed with all that tartar? Trust me, you are offensive. If your teeth look like that, you are offensive to others. It smells bad.
There's another one right there for you, Doc.
Listerine is great.
All right.
I like the non-alcoholic one. There's Listerine without alcohol. I prefer that one.
Okay. And just want to show you there's not all question. There is some. Thank you very much. Right? There's another one, Doc. Thank you. How often? We're almost at the end. Here's one. Let's look at this one.
How do you know if he's a good dentist?
Yes.
Because I read the Bible. No, just kidding. What I would imagine this question, how do you know a good dentist, or what are the signs of a good dentist? I would say a good dentist is someone that is interested in your oral health more than anything. A good dentist is one that is very conscientious on oral hygiene, tooth prevention, and a good dentist, I would say, I'm using myself as an example, is one, you've got to be able to tell that they love what they do. They're going to be, you really can't tell if the dentist is good or not. You just know if you're going to be in pain or not when you're done. But if he loves what he does, he or she, you're going to get the best care because they are enthusiastic about what they do, such as I. And so I would say a good dentist is one that is passionate about his profession and is excited about what he can do for you.
Second to last.
Baking soda. Baking soda can be harmful. everything in moderation. If you use too much of it, it becomes too abrasive. It's not completely harmful. It's just if you use too much of it, it can cause abrasion and cause wear. If you're wanting to use baking soda, does have good properties in it. It has basic environment. It lowers the acidity of your mouth. Therefore, it reduces the potential for bacteria. So it is a good product. If you want to brush with baking soda, I say use it very lightly, or there is an Arm & Hammer's toothpaste that has just the right amount of baking soda in it.
Okay.
I would recommend that.
All right. Okay, so here's the last question. Boom.
Oil pulling, I've never heard of that. What is that? What is oil pulling?
All right. John, Samuel, tell us what is oil pulling, or if somebody out there can put it in the chat by the time we signed off.
I don't know what that is.
They'll tell you that. That's from the University of Adventism. All right. So thank you very much for your presentation today. It was informative, awesome. If you look at the chat, you can go back and look at it and see all the wonderful things.
Yes. I hope we answered everything. I see one here. I guess some of us just, so maybe since you can see the damage, it could contribute to pericarditis and cognitive decline. Yes, it does. Yes, absolutely. Thank you. Thank you. What oil? I do not know what oil pulling is. Water floss. Oil pulling is a mouthwash from coconut oil.
Yes.
Oh. I would have to know what other ingredients are in there. If there is some addictive property in there, that could help. I'm not sure what ingredients are in coconut oil other than the coconut itself. And the coconut oil, I would have to know what the ingredients are in there.
Well, look at this one, Doc.
That's my website. Yep. Using coconut detox. I have not heard of that.
Okay.
And I know the easiest way to eliminate toxins for the teeth, the plaque, it's mechanical. It's not chemical. It is mechanical. It's got to be done with brushing and flossing.
Gotcha.
That coconut oil may be helpful for detoxing the body, but removing the toxins from the mouth is a physical thing. It is the brush and it is the floss. Plaque is only going to be removed physically. Does that make sense?
Yes. Now look at the last one. I know we over time, but Dr. Morrison is giving us a little leeway here.
Okay. Is that my website phone number?
Doc, yes.
That's my website. My direct phone line is that's my website. If you call that, you'll go to my website. I mean, you'll still get us, but there's a direct phone number to my office, and that is 909-931-1281. And make sure they say that they saw this presentation, because then you'll get a free exam. You'll get a free exam and checkup.
That's it?
Yep. That's my office direct line. Yep.
All right. So, Doc, we thank you very much on behalf of this Kansas Seventh-day Adventist Church, the pastor, the leadership of the church. Thank you for the informative presentation. Wonderful. Look at all the chat. Awesome. Awesome.
All right. I can still look at these chat afterwards, right?
Oh, yes. Oh, yes.
Great. Thank you so much. It was my pleasure. Hopefully I made you smile. That's what I do. And if I didn't make you smile today, I'll see you in the choir loft.
All right. Here you go. Bring all the energy you can, okay? All right, Doc.
All right. God bless you. God bless you.
Take care. Thanks for all who signed on. Take care.
Bye-bye.